Welcome to the City Current Radio Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference, empowering the good in our community. We're honored to kick it off with Beth Hail. She's the Regional Vice President with Centerstone. Beth, how are you doing?
I'm great, Jeremy. Thank you for having me.
Absolutely. Let's start with some context. You do a lot of good in the community, multiple communities, in fact, but give us a little bit of an overview for Centerstone.
Centerstone is a not-for-profit healthcare organization. We serve all age groups, children, adolescents, adults, and do family work. We have 23 outpatient clinics across Middle Tennessee that provide a variety of services, and we also do telehealth. So we're able to offer both in-person services as well as being able to offer those services by telehealth.
Dive into some of the typical things that you work with, and I'm thinking anxiety and stress, depression, trauma. Walk us through some of the things that you're helping individuals unpack.
Those are big ones that you just named, especially over this last year. A lot of anxiety and depression, people feeling very stressed. But historically, we also do a lot of work around trauma and PTSD. For children, we oftentimes are treating ADHD, attention deficit, and also child behavior issues, sometimes in the home or in the school. And so we have a variety of services that we can work with the children and families on in those areas.
I know that veterans is another area, working with our military, and so talk about some of the specialization there.
So we offer a wide range of services across the nation to veterans, active service personnel, as well as their family members. And it really allows them to have services both while the person is active military, but also after military life, which is so important for our military personnel.
When you look at your team and obviously the specialization, describe your team, and I'm thinking along the lines of the certifications, the license, all the specialization. So describe your team.
We have a wide variety, but we have medical prescribers. So we have psychiatrists, child psychiatrists, and then psychiatrists that are specializing with adults. We have nurse practitioners that are supervised by the psychiatrists, and so they are the group that is doing our psychiatric evaluations to determine if medication or other treatments are necessary. We also have a wide variety of therapists that work with us. Some are independently licensed, so a lot of times people have heard of LCSWs or LPCs, LMFTs. Those staff can work with a variety of clients. They are independently licensed in the state of Tennessee. And then we have master's level staff that are being supervised by a licensed person. Our case management staff that really work on resources and all of those things that somebody might need to supplement their mental health services are bachelor's level staff. So we have a wide variety of disciplines and opportunities for staff.
You mentioned telehealth, and that's obviously become a huge opportunity to help people during the pandemic. Let's talk about the telehealth first, and then we'll talk about just some of the other shifts during the pandemic, but describe your efforts around the telehealth.
So we, before the pandemic, actually had started doing some telehealth. And what it allowed us to do was have access for some of those clients that didn't have access in their community. So, for example, we might have a therapist in Davidson County, Nashville, and we had somebody that was in the Clarksville area that had to have a particular therapist based on their insurance, and they couldn't get to Nashville. So they were going to have to go out of their way or not get services. So we used telehealth to connect them to that therapist or the med provider so they could go ahead and start receiving that treatment. So we were doing that in several areas, and it just opened up access for some of those people that didn't have it.
I think one of the biggest things when you look at how Zoom has normalized for everyone, so in other words, now this is totally normal how we're conducting this interview. I think that's made it easier for people to embrace telehealth because you realize, oh, wait a second, I can do this. It can be very productive and very helpful. And to your point, very efficient and lower a lot of those barriers. So is that something that you're seeing play out in terms of more and more people embracing this as an opportunity and realizing even in an area where the geographical piece might be there, where they can still get in their car and drive, but now they realize the convenience of it is so much easier. So are you seeing that play out?
Absolutely. There are quite a few clients that we have seen them be more consistent in their treatment because of the access to being able to do this from their home or wherever they are. We might have clients that needed to be out of state to take care of somebody else, but they could continue to, receive services. And so it's been very helpful for access in that regard. So many people have said not fighting traffic, especially in the Nashville area, being able to get around. Some of our parents who might have 2 or 3 children at home, trying to get everybody together in the car, everybody's snacks and everything they need to, go to their appointment. It's just made it easier. There are some clients that, have said, this is just not for me. And where we can, we've been able to make those adjustments and been able to get them into the clinic. But for many of our clients, it's really opened up the door to services that they have not consistently always participated in.
What do you think is one more thing that when you look at the pandemic and the pivots and the adjustments you and your team have made, do you think ultimately it's going to position you in a stronger way coming out of the pandemic? And that could be, with the technology side, or it could be simply just cultural and communication and collaboration, especially with clients. What's something you think, though, has made you stronger?
I think we've had a cultural shift at our agency. So before this, there were only a few people who'd be like, "Ooh, I don't know about telehealth." We kind of got thrown into it, and we survived and actually have thrived after that. So I think that is a piece of it, and we have a lot more of our staff and clients that are willing to do that. I think the other area that I've really seen is all the administrative things. So being able to get teams together where people didn't have to drive and they're missing meetings because they can't be in 2 places or they have back-to-back meetings so they can't be there. We are able to connect with each other, I think, much more easily. I know in the beginning, people wouldn't turn on their cameras and we'd be like, turn on your camera. And now it's just kind of a given that everybody goes there and they're used to that. So I think it's going to allow us to have a lot more communication and collaboration.
Yeah. Switch gears and talk about the school-based therapy that you do and working with the schools and the students.
Sure. We have about 350 school-based staff or schools that we're providing school-based therapy in. And this has been a service line that has been so valuable to our schools and to families. So many of our schools will reach out and they just don't have all the resources they need or can use in regards to therapy. So we have master's level staff that are assigned to a school or 2 schools, and they actually are seeing those students, clients, just like you would if you went into the outpatient clinic. It allows us to really coordinate and collaborate with the teachers and the school staff, and that typically is a lot of times where that child is having trouble. But it also is in a more natural environment. So a lot of our parents really like being able to do their clinical intake and do their therapy sessions in a school setting, which is just a natural setting for them and their child. They're in schools in and out all the time. And so that's been a real positive that we've seen with families.
When you look at the pandemic, I think one of the other things that really has come to light is the focus on mental health and the power of having help and a support network. And so when we talk about the accessibility of telehealth and how that's opened up the floodgates of opportunities for more people to access it, share a little bit around just the accessibility and the affordability and what you're seeing around mental health, especially related to, the impact of the pandemic.
Sure, it's been so stressful for everyone, and I think there's the stigma of mental health, and I think we've done a lot of work to get past that. But also, I think sometimes people think it must be very expensive, and I'm not going to be able to afford it, and my insurance won't pay for it. And thankfully, we have a lot of opportunities at Centerstone where we can use donor funds, grant funding. We've got Safety Net for Children and Safety Net for Adults, which is a payer source that the state of Tennessee has. So there's a lot of options. We always encourage people, at least call, we'll talk you through it, but we're going to figure out how to help you get the services you need. And we don't want that to be a barrier to you reaching out for treatment.
What are some ways that the community can help you?
The stigma, I think, is a big piece. So, making sure that people feel okay about reaching out if they need help. We have a lot of people that will contact staff members and say, I have a friend or I have a coworker. Would you mind talking to them? And so they're connecting us, and they probably don't know, but they might be saving a life. They don't know the impact that they are having. But I think listening to some of those cues and helping people understand it's okay to ask for help, and maybe even, help that person go with them, make the phone call with them, that would be great.
I think so much of it is the communication and remaining close. And, especially in the pandemic where we were feeling so isolated, the ability to still touch base and check on loved ones and family and friends. At the same time, to your point, knowing the resources that are out there and pointing them in the right direction so that they can get help. What are, just based on kind of you as the speaker, putting on your speaker hat a little bit, but just when it comes to tips, advice, words of encouragement, what are some things that you would put out there for the public to know in terms of just being watchful of people and what to look for as signs, or obviously kind of saying the right things, or what are the right things that we need to know, or what are the things we need to know to be good stewards of the energy and the opportunity to guide them in the right place?
I think people are always worried about saying the wrong thing or asking the wrong question. I think the only thing I would say is don't be scared of what you ask or say, but don't not reach out. Ask somebody, check in on people. People that isolate themselves, are a concern. But I think sometimes people get scared they're going to say the wrong thing. And oftentimes it's just a matter of the other person knowing that you care enough to, check in on them, that they would be willing to say, okay, I might need some help, or this is what's going on. So that would be my biggest tip is ask and check in on people and see what's going on with them.
Yeah, I think the biggest thing, to your point before, when you talk about kind of demystifying, destigmatizing, whatever word you want to put in there, when it comes to mental health and brain fitness and, once again, kind of whatever you want to call it on that side, just the idea of, for all of us, we have to look out for each other, but we're all playing a role in this. If we're not open on our end, and to your point, taking those steps and saying, hey, it's okay. Like, let's talk through this. And here's some of the things that I've dealt with and faced. And, let's talk through what you're going through. If we don't have those discussions and you're not yourself stepping out there, we all lose. And to your point, you never know what they're dealing with. And so being open and engaging them and inviting them to have that conversation, even though you might say it a little bit wrong, inviting them to have that conversation opens up the dialogue to then get them the help that they need. And it can be therapeutic for you as well. What's something that you've kind of, experienced over the last 12 to 14 months that's put a smile on your face in terms of the impact that you're able to make for you and your team? What puts a smile on your face?
We had a suicide prevention group that we were doing in the clinic, and we had some trouble engaging clients. These were people that were struggling. They had incidents of having either suicidal thoughts or they had taken some action, and we had brought them together as a group. When we went virtual, for some reason, those groups blossomed. They have really found a way to support each other. I think the telehealth piece provided a little bit of protection, but then once they got used to it, some of them wouldn't be on Zoom for a little bit, and then they, felt comfortable. But they've just kind of taken off and developed this network of supporting each other. And so for me, that's what it's about. These folks they're speaking out, talking to other people who might be experiencing the same thing, saying this group is great. Here's what we do. Here's how we support each other in text, and we check in. And it's just, that's been remarkable to see that happen.
We'll wrap up with contact information. Where do we go? Website, phone numbers. Where would you direct us to learn more?
Sure. You can always call Centerstone at 1-877-HOPE-123. And that's 877-467-3123. And then also 24/7, we have the chat line, crisis line. And also you can reach those folks by 800-681-7444.
So 877-467-3123 is the Centerstone line, and then the 24/7 365 crisis care is 1-800-681-7444, and the website is centerstone.org. So Beth, thank you for all you and your team do. Greatly appreciate it. Thank you for coming on the show.
Thank you, Jeremy. Appreciate it.